the Breast Cancer Awareness Month, and today we have to talk about this pandemic as we have in the past. In the past few months, I think earlier in the year we talked about breast cancer, we talked about cervical cancer as well. So today, because it's a pandemic, we're going to talk about it, and most importantly, how screening is even more critical than ever. Breast cancer is one of the most common form of cancer among women. I think after it or before it is cervical cancer, but I think they are somehow related in terms of commonality in the world. One of the main objectives of the Breast Cancer Awareness Month, what it does to do is it seeks to remind every woman that early detection is key to fighting this disease. Welcome to the Parent Connect Helpline show with Sharon on Hot 93.3. My name is Sharonimouks. Call me Sharon for short. It's good to be back. This is your family, marriage, parenting, and health show. You can catch the show every Saturday 4 to 5 p.m. on Lagos' hottest radio station 93.3, right here in Lagos. So today, we are discussing breast cancer, early detection, and prevention. And as always, I brought the experts. I've got a very good friend who I've been on her case for some time, and now she's here. I don't mean to call her out, but like this I've asked her a couple of times to be here, and I'm so because she's so busy. She's so busy, but she's here. Joining me today is a clinical consultant, public health professional, researcher, and mentor. She's also a medical director of one of Lagos's trusted family clinics. Dr. Perpetua Mbanefo is here. Hi!
Hello, Sharon. I'm happy to be here.
I didn't mean to call you out, but I have to tell people
okay.
how I honor this visit today.
I know.
And I appreciate the fact that you're on the show.
Yeah, I'm happy to be here.
How are you doing?
I'm well. How are you?
Good. And work. This
I
work
work
has
today.
kept you months away from being on the show. How is it going?
Work is going well. Finally here. I'm
Finally,
excited.
yeah. Finally, yeah. Okay, so we're just gonna get right to it.
Good.
Because the way time flies on this show, you cannot believe it. So, Dr. Perpetua, early detection does allow for at least more than 90% of diagnosed patients to survive this, right? So let's talk about how important that is.
Okay. So, of course, according to World Health Organization, in 2020, about 2.3 million women were diagnosed to have breast cancer, and globally, about 685,000 died from breast cancer. So we cannot say this enough. Early detection is key to, of course, finding out that you've got cancer, starting the treatment early, and that increases the chances of survival. You know, the outcomes are better when it's found out early before it will start to spread throughout the body. So yes, early detection is very important.
A lot of people seem to, for us in this part of the world, if it doesn't get too critical, if we cannot move from here to here, or if we cannot do certain things, that's when we know that, hey, I need to go to the hospital. This is serious.
Yeah, it's quite sad because, which is why we're having this discussion, really.
Absolutely, yeah.
It's quite sad because most times people don't really take it serious. The importance of if you suspect something, if you notice something is wrong with your body, go and see the experts, or just go to your primary healthcare doctors or even the nurse to help you examine, and then they can refer you to the centers where you can get definitive diagnosis and of course treatment if it's warranted.
Yeah.
One of the things I found out even in my over a decade practice is that sometimes even the educated ones, we sit on it, we say, oh, it's going to change, it's going to disappear. Sometimes we pray over it, which is not bad, but really there are some things that the more they sit, the more you allow them fester, the worse the outcomes get. And before you know it, it becomes a tumor. Of course, it might be a tumor ab initio, but then it becomes a tumor that might have a worsened outcome if you had presented earlier. So, of course, early presentation, early detection is important to this initiative.
Let's talk now. We'll talk about early detection. I'm just going to lift up from there. How do you know that you've got cancer? Are there some signs, some symptoms women need to look out for that says, hey, okay, I need to go to the hospital right now. This is not normal.
Yeah. Okay. So these are some of the common things. But before I talk about these signs or symptoms, one of the things I want people to take note of is to look at your breast more often. You find out that most women in our society don't look at their breast, talk less, feel their breast. It's actually the men in their lives that feel their breast much more than them. Now, if you knew what your normal breast feels like, looks like, weighs, kind of, the sizes feel like, then you can pick out easily or earlier if there is a change. Now, what are the things to look out for? If you stand in a mirror, it's important to look at the bull breasts. We know bull breasts might not be equal in size, but again, if you notice that one is significantly heavier and you're not breastfeeding, you're not pregnant, it's something to look at, to observe. If you notice there's some deformity in the contour, if you notice that you feel some lumps, or you notice the skin is a bit discolored, either red, or you have rash, or there are some pitting or dimpling that typically resembles the back of an orange, we call that pudororange. Or you feel the breast, whether you're using one hand, or you're lying down, or you're standing in the shower, use the opposite hand to feel for the breast of the other side. If you're touching the breast, one of the things to pay attention to is, am I feeling any pain? Am I feeling any lumpy or lumps inside the breast? Apart from that, of course, you want to look out for the underarm. Is there any mass or any small swelling under the arm? And then it's good to look at your areola if you're in front of the mirror, that is. How is the areola? How is the nipples? Are the nipples being pulled inwards? But of course, you need to know how your nipple looks initially, because there are some women whose nipples might not be the same as most women. Is your nipples, are they being pulled inwards, which we call the inverted, it's being inverted inwards? How is the areola? Is it crusty? Is it ulcerated? Just generally look at the breast, feel the breast for pain, for lumps, and other things. Now, if you feel any of this, when you're done feeling it, it's good to apply firm pressure and squeeze the breast towards the nipple to see if there's going to be any discharge. Now, the discharge can be in the form of bloody, it can be milky for a woman that just concluded breastfeeding, or a woman that has high prolactin levels for whatever reason. If you press the nipples and there is some discharge and you're not sure whether it's milky or not, see your healthcare providers. It can also be bloody, it can be discolored, right? So some of these things. Now, when I tell people what to look out for, it's important to tell them how to look out for this, especially for women who have quite heavy breasts, the breasts that are a bit denser than some of us, or maybe me. So now, what I typically advise women to make it a lot easier, sorry if I'm being so fast, is divide the breast. For instance, divide it into half from the nipple.
We don't mean you should cut it.
No. I mean, looking at yourself in the mirror, assume from the nipple, one is upper, the other is lower, and then further divide that into half horizontally, and then now you have two upper, right and left, same lower, right and left. Now, using either 3 fingers or 2, if you're very good at it, press into the breast tissue and feel. You can either roll it and feel for pain, feel for lumps. You do that on the upper left, you do so on the upper right. You do the same thing on the lower right and left, gently press in. You can move the hands just to feel, see if you're going to feel any lumps or any mass or pain. When you're done with that, put your hands or the fingers, using the pads, of course, not poking, use the pads of the fingers, into the axilla, or what we call the underarm or the armpit. There you're also looking at, do I have small nodules? Are there some swellings there? So I think generally these are the things. If you don't feel any lump but there's pain and you're not menstruating, if typically you have pains during menstruation but you're not menstruating, or you were menstruating and the pain lingered, or the pain didn't disappear as usual.
Oh, doctor.
Sorry.
You're so loaded. Like, no. I love it. I love the fact that because this is your area of expertise, and that's why you're here.
Yeah.
I love the fact that you're going for it and you're firing down. But please, doc, I would like for you to slow down small.
All right.
Can we take that again?
Okay.
How to detect? We're talking about the underarm. I would like for you to just repeat that again.
Okay.
We are taking notes.
Yeah, after you've examined the breast, and then you use we advise people to use the pads, not poking it like this. You use the pads. These are the pads of the fingers. So you go like this to the right and left upper, and you do the same right and left lower. Okay. If you want, immediately you've done this quadrant, you can check the nipple immediately. Okay. Yes, you press in at the center to check for the same thing, either lumps or pain. Okay. And then you can either check whether you have a discharge immediately. You can also press. You hold the breast like so. If you've got a big breast, it might be a bit hard. If you've got a smaller breast, it's easier for you to go.
So you're using almost your two hands.
Yes. Okay. Yes. So you squeeze upwards towards the nipples. Okay. And then you squeeze the nipple itself to see if you've got any discharge. It can be bloody, like we talked about. It can be milky. It can be discolored. Whatever fluid came out of it, take note of it. Okay. And then using the hand of this side, examine the underarm. Right? Still with the pads, you put it in, you check. Here, you check, and then you check the center. Because it's got this side, the lateral, then it's got the upper. It's like they got the roof. Okay. You've got this side, you check, then it's got the roof.
Oh, don't worry, Lagos. You watch the
and
video
all of
later.
that. Oh, there's a video.
There's a video that's coming out. Don't worry. We'll go to our website and you're going to check all that on YouTube and all so that you can see what she's demonstrating. Oh, Lord. Don't worry, we've got you. Let me allow you to continue.
Okay. I think that's about I think that's about it. But the good thing is that for people who are not so experienced, just feel for the much that you can. If you've got a partner, just let them know what the doctor said to be done, or just tell them to just feel the breast.
For you.
Now, you can do it, like I said, looking, where you can put your two hands down by your sides. Okay. You look. When you're looking, that's inspection, you visualize. You're looking for the shape. Of course, you would have known what the shape of your breast looks like. The
so
contour.
That's why you need to pay more attention to the body. Yeah.
So if you've got a mass here, it's very possible that this breast might be bigger than this. And if, depending on the size of the breast, that might distort the contour of that breast that has the lump. Okay. So you're looking for it. Okay. How is the shape? How is the size? Any deformity? Any changes in the contour? How is the nipple? Okay. Yeah, how is the nipple? Any areola deformity? Any crustiness? Any rash, any discoloration? How does my nipple look? Has it changed? Okay. Is it pulling inward? So this is what you do by looking. Now, still standing in front of the mirror, you can also put two hands by your hips or waist or whatever, and then try to press in, like you press in. When you do this, it kind of firms or puts tension on the muscles of the chest wall, the pectoral muscles of the chest wall. And when it does this, if there's anything underlying or within the breast, it might make it more prominent because, of course, you've put some tension. Yeah. So, of course, that's kind of either pulls up, whatever it is. Yes. But, so that's what you do looking, right? Now, after the looking, whether you're in the shower, you can also do the same quadrants that we've talked about. Yes. Again, we recommend people to lie down because when you lie down, the breast kind of spreads evenly on the chest wall. Yes. One of my surgeons, he says the breast is like fluid. It flows. So, of course, it's going to flow around, and then it makes it easier for you, especially inexperienced people to be able to palpate easily. So when you lie down, you can, or you may not need to put a small pillow under the shoulder. Or let's say you want to start with the right breast. So put a small pillow under the shoulder of this right shoulder. Yes. Put this arm under your hand, like so.
For the right arm
so it kind of gives the breast the room to flow in And remember, the breast also has a tail that moves into the axilla a bit.
We can
Yeah.
feel that sometimes.
Yeah, so that gives you that space. And then using the left, we're doing the right breast first.
Yeah.
The same parts of the
3
fingers.
fingers.
Remember, visually, you've kind of divided the quadrant to make it easier.
Yeah.
Then you go, you go like so, upper, lower,
Okay.
and then if you're not sure, stay a bit, right, till you're sure. Some people have very heavier breasts. Some can really tell when there's something within their breast. So when you've done that 4 quadrant, then you press into the nipples. Then you go to the axilla or the armpit as we know it. You try here, which is of course this wall.
All right.
Some people will say here, and then you just go in the kind of the roof
Of the armpit.
Yeah. So, do the same
For
to the
other
left.
arm, so,
Anything you find out, go see the doctors, but don't forget before you finish to see if you can test the breast if it's expressing, if it's discharging. So depending on the size of your breast, if you've got a bigger breast, which is fantastic, start a bit higher up and just squeeze. Plan to converge at the nipple when you're moving.
Okay.
Apply a bit of pressure and squeeze. Get to the nipple and then press. And then if it's got some fluid, there will be some discharge, and you'll see it. Do the same thing for the left.
Yeah.
And I think that's about it. And this is what we call the self-breast exam.
Yes.
It's advisable that we do it every month.
Every month.
Yeah, not around the period.
Menstruation.
Yeah.
Period. Yeah.
Because most women kind of have a bit of discomfort. Their breast is a bit more heavier and all of that, so that you're sure what you're feeling. And then if you're breastfeeding, your breast might actually feel heavier than usual. It doesn't mean when you feel a lump and you're breastfeeding, it's actually a breast cancer. So what you need to do is, if you suspect that lump is a bit unusual, because sometimes breast milk, sometimes if the baby is not fully expressing or fully emptying that breast, there's a tendency for the milk to kind of aggregate and all of that. So for women that are breastfeeding, we advise you monitor it and then see the doctors. Let your gynae or your obstetrician know. Let's monitor it. The best time for breastfeeding women or lactating women is after they are done with the most, if you're doing exclusive, to be able to see if the breast activity will settle, and then we can actually be sure which one is a tumor, a lump, or just the milk. Yeah. Okay. I think that's about it.
Yes. Oh wow. This has been already so expository and enlightening. You're listening to Lagos' hottest radio station, Hot 93.
Now I tell people, by being a woman, you're already at risk, right? Of course, men have a very lowered risk, about 0.5 to 1% chance of having breast cancer, even in men. But in women, the risk factors that are not modifiable, by that I mean that is not subject to change, is your sex. The fact that you're a female by gender puts you at a very high risk. And then another thing is age. Women that are 40 years and above are at increased risk of breast cancer, Other things that you cannot change really would be something like family history. If your mom, your aunts, or someone in your family has breast cancer, that puts you at risk. That does not mean that a woman who doesn't have a family history is not at risk. The person is still at risk by being a woman, but for the person that has a family history, you're also at risk.
Okay, almost like a greater risk, or?
For some people, they might say a greater risk, but we're all at risk, as as the case might be, by just being female and having breasts. Now, of course, if you've got breast cancer before, it's a risk.
So you
factor.
can have it before.
Yes, of course. Some people have cancer and it's treated, and they've been declared free. It can recur.
You can come back.
Yeah, it can recur, and the fact that you've got a breast cancer before puts you at increased risk. Now, these are the risk factors that you cannot really do much about. You can't choose the family you're born into, and all of that. The age, of course, is something that progressively increases. You can't do much about it.
Okay.
But there are risk factors that you can change.
Okay.
For instance, if you're consuming high alcohol, high intake of alcohol, cigarette smoking, you're not exercising,
Hmm.
and maybe by choice, you've chosen not to breastfeed.
Okay.
That puts
That's
you at
after,
an increased
that's after
risk.
giving birth. You chose not to.
Maybe, of course, there are some women that maybe medically might have a contraindication to breastfeeding.
Okay.
And I know there are some women, even after giving birth, they have unsuccessful, they cannot breastfeed. I don't know.
Mm.
For whatever reason it is, research has found that women who are able to breastfeed, right, are at lower, they have lowered risk of having breast cancer because of multiple reasons. For instance, the fact that that breast is lactating, that's expressing milk,
Yes.
kind of delays your menstrual period and kind of reduces a hormone we call estrogen. And research has found out that estrogen kind of increases breast cancer cell growth.
Okay.
So for women who don't breastfeed for long, you find out that they have higher estrogen levels, and that might act upon a cell that might be abnormal, right?
Wow. Okay.
Now, another thing breastfeeding does, which is quite good, especially for women who do exclusive breastfeeding, which is breastfeeding for about 6 months without water, liquid or solid feed for the child.
Yeah.
Studies have found that they are at lower the risk.
Okay.
Again, because when you breastfeed, the breast kind of sheds. The shedding helps to shed off some cells that might be abnormal. If you remember what cancer is, cancer cells are cells who, maybe due to environmental factor, genetic mutation or whatever, a normal cells now becomes abnormal, and then there's some form of dysregulation of the cellular division.
Okay.
And then that cell just continues to multiply and go out of proportion and all of that.
Okay.
So now breastfeeding exclusively for a longer time kind of reduces your risk because it helps that breast to shed cells who have maybe abnormal DNA within them, something like that. So researchers are recommending women who have no medical contraindication and who don't have anything against breastfeeding. We recommend that you breastfeed. There are so many benefits for breastfeeding. Of course, this is not for breastfeeding, but apart from the benefits, it's also beneficial as a means to reduce your risk for breast cancer. And there are the other last risk I might talk about is women who are menopausal that are on hormone replacement therapies. That hormone that you're using can prime the breast cells, especially if there are something there, to become cancerous. So what we recommend is that women who are menopausal or postmenopausal, as the case may be, that requires hormonal replacement therapy should discuss with their healthcare providers about their risk of breast cancer. Yeah, I think that's about it.
Okay. Wow, interesting. Thank you, Dr. Perpetua.
You're welcome.
That's quite enlightening. So thank you for that. Okay, but I'm just going to lift off from what you said. You said, you are also at risk if you've had a history of breast cancer. What makes it come back?
I don't know.
Just like that?
I don't know what makes it come back. But what we found out is, of course, aside from the known risk, predominantly, the cause might be unknown. Of course, but for someone who has had cancer before, the risk is even higher for you, than someone who has not. So that's one of the unmodifiable risk factors, the risk factors that are not subject to change if you've had that before,
Wow, so there's no reason. There's no medical leave.
It might be that it all depends on the kind of tumor cells or the cancer that is being treated. It might be the therapy, it might just be that, of course, you were declared free before, and several years it comes back. You've heard it in stories before. People that are having, they've gone for chemo and radiotherapy before, and they were tested and didn't have any cancer cells again. Years later, might still have it.
So let's talk about the complications. We're going to come to that.
Essentially, right, as with any other cancer, if, of course, by the nature of what we know is of course the kind of structures within the breast. We've got a lot of fatty or adipose tissue, and then we've got the dots, and then we've got the lobules, which is actually where the milk is being made.
Okay.
Now, depending on the type of cancer that you have, if it's a cancer that is not invasive, right? I'm not talking about benign lesions or benign growths by nature, not life-threatening. They are benign and they cannot spread. But cells or tumors that are cancerous or malignant, as the case is, some of them might be non-invasive. By that I mean they can stay in the organ of origin. Maybe if it's in the breast, they can stay there. They cannot invade into surrounding tissues like your bone, the skin.
Okay, the other let me break it down, okay?
So
the other synonym for invade is they cannot spread.
Yes, spread. Okay. Yes. So now we've got the one that is not invasive and the ones that are invasive. Now, the risk and the outcome depends on several things.
Okay.
It can depend on the kind of cancer cell we're dealing with, where the cancer originated from, whether it's in the ducts, which are the things that converge to the nipple to open up at the nipple that brings out milk, where the milk comes out from.
Yes.
If it's also in the lobules of the milk producing glands within the breast. Now it depends on the type of cancer we're dealing with. It depends on if the cancer is invasive, that it can spread to multiple, it can spread to surrounding organs or even distant organs. The outcome or the complications depends on several things. It depends on the person's lifestyle and other things. It depends on maybe the kind of treatment and all of that. And depends on if you even want a treatment. And again, some cancer cells might not be responsive to maybe chemo or radiotherapy or even a combination of both. They might be hormonal in nature, might respond to hormones. So the complications will be complications of cancer per se. They can spread, affecting the organs, and of course, it is life-threatening. A woman can die from complications of breast cancer or of untreated breast cancer. Some people, due to even some of their adverse effects of the treatment of the cancer, might suffer some poor outcomes or quality of life and all of that. So I would say, for me, I don't like focusing so much on the complications. I like people to think about to be more intentional in terms of taking proactive steps with self-screening, self-breast exam, clinical, coming to the clinic for clinical breast exam. If you're 40 and above, going to see your doctor, request to have a mammogram. If you're under a hospital.
Now we're talking about the screening, Let's talk about it. No, I love that. Go ahead, Doc.
So part of the screening is the examination itself.
The self one, okay.
Then, if you're 40 and above, we recommend that you get a mammogram. Of course, speak to your healthcare providers. They'll do the exam and refer you to get mammogram. Then, if there's a lump in any of the breasts, or if there's pain, or something felt within the breast that is out of place or non-normal. I'm trying to use simpler words now. The doctor can refer you to get an ultrasound scan if you're less than 40. They can also send you to do mammogram if you're 40 and above. Now, depending on what these two found out, another step is to have a histology, which is getting some piece of the tissue in question, of the growth or of the tumor cell, whatever it is in question, and look at it under the microscope or do the histology to find out what kind of tissue or what kind of cell that is, to be able to classify, the the cancer,
Okay.
to know if it's cancerous or not.
So
Then
how do they do that? Do they have to, is it an incision or you don't have to do an
it
incision?
depends on the mass. It depends on the size. Depends on what the doctor's preference is. Some people want to do needle. But of course, it will still be done in a hospital, in a theater. They can do needle aspiration of biopsy. Some can do core tissue biopsy. It all depends. And then, depending on the doctor as well, they can either choose to have a guide, either ultrasound guided biopsy, MRI guided biopsy. It all depends. Again, another aspect of the screening that takes it a little bit higher, depending on your initial presentation. Now, the doctor might need, in addition with waiting for the histology results to come out, they might want you to do an MRI, magnetic resonance imaging. Of course, maybe the breast, look at the chest and other areas, just to know if there are some deposits or some spread around. Yeah, depending on your presentation.
Yeah.
The first time.
That's why it's important to go for this investigation.
Yeah, that's why it's important to come early. So I think these are the commoner ways. Or of course, examination, ultrasound scan, less than 40, mammogram 40 and above. You can also have an MRI imaging done. Of course, there's the option of doing a biopsy to actually take a sample of the tissue or of the tumor and have it looked at. Yeah, I think that's about it.
Okay. Quite interesting. Quite interesting. Thank you, Dr. Perpetua.
Thank you
So
much.
we're just gonna keep going. I'm just lifting off because I'm sure a lot of people are. This is more like maybe a class and masterclass. It's okay. You guys are welcome. Yes, that's what this show is about. We pride ourselves in bringing the experts, and of course, she's a consultant and she's doing her job excellently. Breast cancer.
I cannot say absolutely not. But again, if it did not present within the period when she has higher estrogen levels in her system, which is one of the risk factors. Of course, there are other risk factors, right? But from 40 above, remember, if she's above 40, she's a risk. She's a woman,
Still.
she's a risk. Of course, her risks might be lower depending on, she breastfed well, other lifestyles modification are in place, there's no family history. I can't say per se, but if a woman is menopausal and finds a lump, she should please see the doctors to be sure. It can be cancerous. Okay?
Yeah, it can be cancerous.
Yeah.
So let's look at, I know you mentioned it a little bit, but I'd like for us to delve in a little bit into the lifestyle modifications that can prevent cancer. I know you mentioned about not alcohol. Is there anything else you might want to add?
Okay, so studies have found that reduction in cigarette smoking, having an active lifestyle where you exercise regularly or as often as you can, helps to modify your risk, right? Of course, other issues like if you can breastfeed. If you can breastfeed longer, the benefits are quite higher the longer you breastfeed. Apart from to breast cancer, it is quite good. So those are the modifiers, and of course, what you eat.
I was going to come to that.
Yeah, of course, what you
put in your mouth.
Yeah, because if you look at this, physical inactivity or not exercising, you marry that with obesity or not eating properly, drinking alcohol, and of course, you will know that most of these things, there would be obesity underlying in it. Okay, so obesity is another risk factor. But I think when people exercise and modify their lifestyles, incorporate more physical activities and eat healthy meals,
Yes.
I think that would reduce their risk.
Okay, let's talk about cost of screening because I bet a lot of people I love what you're saying, but is it something that I can afford? Let me talk about that in terms of cost.
Okay, so for me, I think now more than ever, right, breast cancer screening is a lot more affordable than before because now you even see people coming into your community to do free breast exam. Let's start from there, right? Ultrasound scan, they're not the most expensive. If you're above 40, mammogram, which can be a bit expensive, but there are centers that offer discounts from time to time, right? In fact, I was talking to one of the doctors at Lily Health. This is not a promo or anything, but they were doing community screenings. They had mobile mammogram with them to screen.
Okay.
So I don't want people to be held back due to the cost. If you look at the cost benefit, your health, your life versus finding out if you've got a lump, if you've got a tumor that needs to be taken out or that needs to be treated, I think you can. Let's look for ways. There are centers that offer discounts. There are centers that do community outreaches to screen. Some do free, some do at discounted prices. You can start from there. I know the other things where diagnosis might be a bit expensive, maybe the histology, but now it's not that expensive anymore. It depending on what the doctor is suspecting. Of course, MRI is a bit expensive, but let's even find out. Let's even go for this screening.
Let's go fast.
Yeah, let's detect it early, and then the discussions will continue for how to treat.
Yeah, detection is very key.
Key.
Like
Yeah,
that's
it
like
is.
the core of the whole matter.
Yeah, it is. It is because you cannot fight what you don't detect. You cannot prevent what. Of course, you can prevent it, but I tell people a lot. How would you begin to respond to something you don't even know you have? So the first thing to do is keep on, be vigilant every month. Do your self exam.
That's very important.
Yeah.
Thank you, Dr. Perpetua. So
You're
I just want
welcome.
your final thoughts. This is the Breast Cancer Awareness Month, and I know there are a couple of initiatives that are going on around, like you just mentioned, that are going on around Lagos, around the region. So let's have your final thoughts to women out there, who this is a concern for them, whether it's in their history or not. Let's have your thoughts.
Okay, so my final thought will be this. I don't want to give you a story, but I've got the commonest stories I always tell. The
Yes,
woman that she's got a lump for a while, but she never touched her breast. She didn't know. It was her husband. One of the days where he was, really feeling the breast, something like that, that he said there's something here. He felt something before, but his mind wasn't there, but it's still there. You should go. But she owns the breast. She doesn't touch it. Most women just bait and go, So I think we need to pay more attention. Then another case of a woman that touches her breast. She is educated. She has the financial capacity, but she thinks, oh, it will go. Oh, it will disappear. Like women, sometimes we don't take these things really serious.
Yes.
We kind of sit with it.
Yes.
We make room for it.
Yes. Yes.
So what I tell people, please, these things are important. That's why
Yeah.
we're having these conversations.
Yeah.
Pay attention to your body. Look at it. Look for these signs that we've all talked about. And if you find something, go and speak to someone. It might not be an expert. Go to your primary healthcare provider or primary healthcare center. Go to a matron. Go to a doctor, a GP. Or if you have the means, go and see a specialist. Let's start from there. Okay?
Great. Thank you so much, Dr. Perpetua. We've got, the heart to talk about this topic, and I do really appreciate you being on the show. Thank you so much. I
I'm
look
happy
forward
to
to
be
having you again.
Yeah, sure.
Okay, Lagos. This has been the Parent Connect Helpline show on Lagos' hottest radio station, and this is the Breast Cancer Month, like we talked about. We are trying to create awareness. It is so important. This is a pandemic, and like you've heard today, this can start for the fact that you're a woman. You're at risk. You can find her on Instagram at Dr. Chocolate, then UG. Yes, U for umbrella, J for jog. So Dr. Chocolate, UG. I've asked her why Dr. Chocolate, because she's pretty, of course. But of course, I don't know why. There must be some history behind this so much, because I'll see you next week. Do take care.
Bye.